Traditionally, symptoms have been one of our top diagnostic tools. If it's itchy, it's allergy. If it's dry eye. If it's blurry, you need a glasses change. But welcome to the new era where nothing is as it appears. In reality, all three of the above symptoms may point towards one or multiple diagnoses. We'd like to focus here on the symptom of itching. Although history aspects of the exam can point directly to the condition being definitively allergy, such as it's pollen season and I'm sneezing, or my neighbor's cat snuck into my house and slept on my pillow, often it's not that simple. When a patient presents with the symptoms of itch, we need to look at the entire ocular surface before jumping to too many conclusions. First, we begin by looking at the eyelids. Do they have signs of blepharitis that may cause inflammation of the eyelid and thus the irritation and itching? Does the patient's glands flow when pressed on with an MGE? If not, they may have meibomian gland dysfunction as the cause of their itching. Before moving to the globe, we like to look at the palpebral conjunctiva for papillae and/or follicles. Make sure to flip the upper eyelid to look for signs of GPC, especially in contact lens wearers. Next, we move to the tears and globe. It's our normal protocol to consider the adenoplus test for anyone with red eye. We do this because we believe that a viral condition is the great mimicker and can take a great multitude of symptoms. Thus, rather than misdiagnosing the patient, we generally will do a quick sample of their tears and continue the remainder of our exam during the 10 minutes that it takes for the test to conclude. And lastly, we look at the corneal surface with the use of fluorescein dye to look for irregular patterns in the tear film and corneal surface that may shed light on the itching. Both of us used to think that there may be some sort of pattern of redness that could signal one type of condition or another, but in reality our appreciation for pattern redness has certainly been challenged by true dry eye, MGD, viral, bacterial, and allergic cases. One quick test that, although not definitive, can help us with differentiation is the allergy drop challenge test. We place an allergy drop in one eye of a patient and an artificial tear in the other. At the conclusion of 5 to 10 minutes, we ask the patient how their eyes feel. If both eyes feel the same, it may help to conclude that the patient has dry eye. But if it's allergy, the patient may report improvement in the eye that had the allergy eye drop and not the artificial tear. It's not always conclusive, but it can be helpful. We have noted that the nerve receptors in our patients' eyes are notorious for playing tricks on us. The sensation of itch tends to be a prime example of this. Although many times it is allergies, don't forget to look for these other causes of the itch.